The vision of the Hospital for Sick Children for many, many years has been healthier children, a better world. And the mandate of the Center for Global Child Health is to improve the lives of children and their families in resource-poor environments around the world. The center meets its goals of helping children and their families around the world really by having a strategic direction that includes 3 distinct pillars. And the 3 pillars are doing research related to children and their families around health, around nutrition, around cancer, around maternal, newborn, and child health. The second way is through increasing the capacity of people working in health around the world. And the third is really putting the first 2 together by doing what we call knowledge synthesis and advocating for better conditions, better health, better ways of living for children and their families around the world.
At this point in time, the global needs in child health and development range from survival to quality of life to long-term outcomes, so it's a pretty vast area. This center offers a huge opportunity for young people to be engaged in scholarship, to be engaged in serious academic work, and to influence change in some of the key geographies where many of these problems are clustered. And moving forwards beyond the Millennium Goals to the Sustainable Development Goals, a major focus is on evidence-based programming and implementation to reduce some of these differentials and equity gaps across the world.
The role of the Center for Global Child Health is to select projects and partners where we can ensure that our expertise fits with an identified need, where there's scalability, potential of the project, sustainability, and where our partners can take ownership of the program and carry it forward without us.
The Center for Global Child Health really relies on partnerships in order to advance the work that we're doing. We can conduct incredible research and we have great minds here, but it's only through partnering with non-government organizations, other clinicians and researchers around the world, governments, communities on the ground. It's only by doing that that we can fill the gaps and make sure that what we're doing comes through and is implemented and sustained in a long-term fashion.
If one is going to really make a difference, you've got to partner with countries where the disease is most predominant, where the heaviest burden of the disease is. So partnering with other parts of the world is a moral imperative if we are going to make an impact on children's health globally.
Collaboration is essential. We can be involved in the scientific rationale and the design of the studies, but we depend entirely on partners for developing that question and the study design in a way that's appropriate and feasible in the local context in which we're conducting the research.
Research is extremely important to provide a strong evidence base, and not just research, but rigorously performed scientific studies that are controlled.
Through my work, I hope to generate evidence that can help decision makers in implementing the right policies to help improve the life of children and their mothers. The end goal is to reduce child mortality and to save lives.
I saw the importance of a really healthy start in childhood and the way it sets the stage for the rest of a child's life. I really hope that I can contribute to making sense of what we know about most effective interventions to improving maternal and child health and affect policy.
Our hope, of course, is that our research will produce results that can be incorporated into public health practice in the future.
Many of us at the center sit on important committees that are run by the United Nations, by the large NGOs, and through sitting on these committees, we can impact policies that improve the lives of children and their families around the world.
Moving forward, I think the greatest success in global child health is doing exactly what we are trying to do here, is to connect communities, connect young people who are so motivated in terms of being global citizens, and ensuring that the one world and the only world that we have, that we live in, becomes a much better place for our children than it is today.